Now we're going to be assessing your nose, mouth, and neck.
Okay.
Melissa's nose is midline, proportionate to her head. And then I'm going to be looking up your nose to each nair. And I have the light turned on. I'm going to assess that her mucosa is nice and pink and moist on the right. Turbinates are also nice and pink on the right. And on the left side, it's nice and pink and moist. And the turbinates are nice and pink, and there is no deviated septum. If you hold one side of your nostril and breathe for me, good patency. And on the opposite side, breathe, nice patency. Now I'm going to test the olfactory nerve, and I'm going to place a smell with your eyes closed up to your nose. And if you hold one nostril shut, and tell me what you smell.
Cinnamon.
Very good. And the opposite nostril with your eyes continue to be closed. You smell?
Alcohol.
Very good. Good sense of smell. Now I'm going to be moving down to your mouth. And I'll have you open your mouth for me, please. And I'm checking her teeth. And her dentition looks beautiful. And stick out your tongue, nice and pink, with a normal texture of pink with a little rough patches on top. And then I'm going to have you stick out your tongue and say ah.
Ah.
Uvula is midline. Tonsils are visible 1+, and soft palate rises when she said ah. And then you can have your tongue back inside. I'm going to look underneath your tongue. Actually, let me check your gag reflex. Stick your tongue out. Okay, she's got good gag reflex. And now I'm just going to look underneath your tongue to see if there's any nodules or lesions. None are present. And I'm going to check the inside of your mucosa. And that's nice and flat. And that side is nice and flat, and both are pink. Now we're going to move down to your neck. And I'm going to feel for the trachea. Is midline with no deviation. And then I'm going to have you turn so that I can assess your thyroid from the posterior aspect. And I'm just assessing for enlargement or a goiter. I'll have you swallow when I get to there. Swallow for me. Very good. No enlargement is noticed. All right. And if you'll turn back towards me, I'm going to listen to your carotid arteries for any bruits by turning over to the bell. No bruit is heard. No bruit is heard. No thrills felt. No thrills felt on the carotid arteries. Then I'm going to feel the jugular vein on each side, one at a time. And I don't see any jugular vein distension. Then I'm going to check the range of motion, and I'm going to have you tuck your chin to your chest, flexion, and then extension is back, good, and to the right, your shoulder to the right with your ear, and to the left shoulder with your ear, good lateral move, good range of motion. Then I'm going to have you press against my hand, good, and back against my hand, and laterally against my hand, and laterally against my hand. And that concludes that section.